So I can introduce to you Professor Marina Dankaerts from Leuven, pedopsychiater, and she is taking the lead as expert, and the other expert is Professor Coté. And we have prepared two questions, questions that were found very important by the youngsters, and the first one is about the implementation of the biopsychosocial model in our healthcare system, because all the endeavors and the money is mostly going to the somatic care, and there is no integration with biopsocial, and all the money is also going to somatic. Only 6% of the budget is going to psychological care. That was the reason that in the end I have said to the minister, yeah, but you have to change the money also because there is not enough. So I give immediately, yeah, you know already, I think, Professor Georges Casimir. He is the president of the French-speaking part of the Royal Academy. And I am Joke Denekens. I am pensioned already, but I work still a lot. And I was 10 years vice minister, vice rector of the University of Antwerp. So, Marina, perhaps I can say that we are going to work around the first problem in 15 minutes. And there is a short theoretical framework introduction by Marina. And then the floor is yours. And we are going to share our experiences and where we see solutions for the problems. Because in the plenary session, the conclusion session, we have to present 3 slides. And one of them should be the proposals for solutions, and especially in an intersectoral way, solutions intersectoral, and who will be responsible as for the ministers. So, Marina, the floor is yours.
Thank you, Joko. The slides are there. Okay, my first slide was for all of you. This is supposed to be a workshop, so I already talked to some people during the break, asking them to really work. All of you have been specifically invited by the Royal Academy, so we hope that all of you will speak from their own perspectives to the problems that we are going to present to you. And the problems are not the ones that we chose, they had been chosen by the young people and together with the academy. So we took the problems from the list that Professor Sabba this morning presented. This is our first aim that we need to think about. And so what we need to try and do is to translate this idea of the fact that the biopsychosocial framework, even though it's already very old as a framework, that we can't really say that in Belgium we are really living up to it. And the whole idea from the Royal Academy was, how can we make it more obvious during every basic training of every caregiver that a biopsychosocial perspective is what they need to react upon. First of all, maybe I would like you to say something about, do you recognize that problem and how do you recognize that problem from your perspective? So either a clinician perspective or from a governmental perspective or from the youngsters that are here. How do you recognize that problem? How do you recognize it in psychological or psychiatric care? Mark? Are we going to use microphones?
Yeah. No, I will come around with mics.
I can start already. I think talking to psychologists, I see that it is sometimes very difficult to add these biological aspects by introducing. Thank you. I think talking with psychologists, many times it's difficult to invite them to look at the problem at stake and take a biological viewpoint and say, look, this is a depression, it's a severe depression. I imagine somebody from 16, 17 years old, an antidepressant could be add value, could be very useful to increase clinical things. The other way around is transdisciplinary. In many teams, you see a split in a team in the regard to using drugs. Part of the team is much pro. They expect too much of a drug that is administered.
Medication, you
medication,
mean?
yes, to medication given to, the medication given to youngsters. And others are completely against this.
Against it, yes. Okay, someone else who wants to first define the problem a bit. Where do you recognize it? Where do you recognize it in psychiatric care?
I think I also see it in the, Mark gave the example of a psychologist that is not seeing the biological part. On the other way, or the other way around, you sometimes see that a child is being treated for somatic problems and a pediatrician or somatic medicine is looking into it, and there is a point they don't have an explanation anymore, so they tend to tell us it stops here and you have to take over. So it is referred with Breukleen and
it's a sort of either or. It's either
it's not working
somatic.
together like.
Okay. If you like, you can speak in your own language as well, in Dutch and in French. It doesn't really matter. Someone else who sees the problem somewhere, maybe?
Important for care providers and for physicians, but it's also very important for the general population because it's not sufficiently known in the general population. And I think that the media, TV and others kind of media could improve the knowledge of the general population about the importance of the care of the very young child, as very well demonstrated in the presentation of Professor Coté this morning.
In that sense, we still have a lot of common language that is like still supporting the split in somatic medicine on the one hand and psychological help on the other hand. And he has something between his ears, or we talk a lot in language that is supporting that point of view. That's true.
Yes.
So from, as an outsider, I want to say discussing today are not unique to Belgium. In fact, I think on some respect you might be in a much better shape than many other places. I'm talking OECD countries that I know of. I've seen lots of motivation from politicians today. I'm quite impressed. And so with regard to the challenge of integrating the biopsychosocial aspects, my experience with it is that sometimes in pediatric care, pediatricians see children that look like they have developmental delays, like because they score in a clinical range in terms of delays, and really by prescribing, entre guillemets, a preschool education or crèche or a psychosocial service where the child is stimulated, it can bring up the child's development so that really what was wrong was a lack of stimulation and not a neurodevelopmental problem. So this is an example where intersectoral action is absolutely critical. I do not think that I'm a psychologist, and I respect the profession very much. I think there's a huge margin of improvement we can do for people's mental health, but I do not think that we will ever have enough mental health specialists to help everybody who needs it. So population-based intervention, community-wide intervention, health promotion interventions with participatory actions are, I think, a key step in fostering mental health for all, and then another level for those who need it more.
I would like to keep that on hold a little bit, because that's our second topic, where we're going to look into primary prevention. Yes, please.
I'd like to add something that's going into that direction. There is not only a split between the biopsychological aspects, but also the social aspects are very often forgotten. So we are always looking at the child, what's wrong with the child, how can we change the child without looking in the environment, what's probably or possibly causing problems, or what could be of use to resolve or prevent problems. So it's very much what you are saying.
Definitely. I liked the blue bit of this slide, where people are saying that, okay, I have some sort of somatic problem, and that needs to be solved, and my doctor knows pretty well what I need to do for that, but that is not what is helping me, because I will need motivation to keep on going with this treatment or whatever I need to do for my problem. I need people to support me, and it's those things that will help me to overcome this problem, and not just the simple somatic solution that my doctor gives to me. And I know that we're now talking about things that don't seem to be touched upon this morning, but it was one of the true aims of the Academy, that we need to think about basic training for somatic medicine, for nurses, etc. Because of exactly what you were telling, we will never have enough specific mental health carers. So a lot of that basic motivational work needs to be done by those that are curing or trying to help the people that have the disease. Yes, you wanted to add something.
Yes, I think there's a distinction here that is important to make. We want, I think, medical practitioners to be sensitized to the psychosocial health issue, but I don't think they can address them. And I think people expect a lot from the medical specialist. That's why intersectoral action is important, working together. A medical doctor, we go see a medical doctor because they are specialized in whatever health problem, and not in psychosocial. So yes, being sensitized to be able to refer, to link to services, but I don't think we can expect them to become psychosocial intervention.
Well, I'm not so sure about that. Sarah?
I also think there should be a shift or a shared authority in it, because there's when you have a psychological problem, the doctor is the my English is fading out at the moment.
You can say it in Dutch.
Is the autoriteit, is the expert. But I think there should be a shift. When you look at hospitals, it's de artsen die zijn verantwoordelijk. De artsen die maken carrière, terwijl heel veel psychologen enorm veel werk doen daar.
Because psychologists are working a lot. It's not only about doctors who need education in the psychosocial aspect. There must be a transition, a change within our culture. And everyone needs to pay more attention on psychosocial. This was one of the questions that was raised this morning. Why a GP is reimbursed and not a psychologist? Indeed, but I'm trying to defend the integrated approach.
that people in somatic medicine also can already mean a lot to patients when they are more aware of trying to support those psychological and social issues. It's by dismissing them that they are overlooking them, and then patients get sent home after a 2-day hospital admission, and then they're supposed to care for themselves without any help. I think it should not be completely split between persons. You don't need a psychologist for everything that needs to be looked at in medicine. We're looking for solutions here towards basic training, but because now we need to produce solutions. How are we going to make this happen in the training programs of all these carers? But you wanted to add something.
Ja, ik wilde graag iets aanvullen op wat er daarnet gezegd is. Het lijkt...
Yes, I wanted to echo what has just been said. When we have a look at the different levels in the management, it is understandable that we need specialists. And not every specialist can be a generalist. I think that at one given moment you need to deepen your knowledge in an area if you're a specialist. But I don't think that we should divide psychologists and generalists. We have pediatricians, we have doctors specialized in youth care, in prevention as well, and they are very important for the development of children, generally speaking. I would like personally to broaden this, especially the social backdrop. More often than not, the influence of teachers is overestimated. School teachers, primary school teachers, are often the only contact point of children in a classroom, and teachers are clearly well positioned to understand the child and can mean a lot to this peculiar child. That's not always the case, having said that. They are not always appreciated in their role, their face value. And it's not only about realizing educational goals, it is also about supporting children. We will bounce back on this in topic 2.
Training people in welfare, training people in medicine, and how are we going to help them to look through the biopsychosocial glass?
Ja, ik ben eigenlijk mama. Voor mij was het gewoon moeilijk om de...
Hello, I'm a mother, and for me, it was fiendishly difficult to find the right path. People did not believe in me. At school, teachers do not always see that. You arrive at school, you wear a mask, and then you come back home, and you have a completely different behavior. That was the case of my child, of my son. I thought he was autistic. He was tested in 3rd maternal year by a team, and then a psychiatrist, child psychiatrist, told me, your child is not an autist. At 11 years old, he got that diagnosis, and having said that. And the trajectory we had from not autistic to autistic 7 years later with school dropout is difficult. I wanted to talk about that.
Because some people get trained in topic X and A and Z, and other people get trained in topic ABC, but they don't know about each other's topics. So,
Marina, I was listening very carefully, and I thought perhaps we have to make a search for what kind of model do we need in our daily practice to implement the biopsychosocial model. So we are with so many different caretakers and caregivers, and the center of our care is a young child. So I thought perhaps we have to look for another way of working with children. Perhaps we have to work, general practitioners are not well trained to do it, but a kind of general practitioner that is more broad trained and especially biopsychosocial. And perhaps not directly in diseases, but in health, to look more in a preventive way and to tackle early detection and to be aware of the complex situation of those three different aspects. And I think we need another kind of caregiver who is overlooking the total situation and then is saying, and you can go to a psychologist and you can better go to the kinestist, for example, or another, you have to go to sport, you have to do literature, or you are going to perform in a theater. But a person who is making the analysis of the problems in the three domains and then can refer to the good caregivers in their different specialties. You have said it, there are so many specialties and so many high specialists, so you need someone who is good in common things and can then refer, but it's only an idea.
It could be one solution that you create a super diagnostician. The other solution is, of course, that every training starts from the biopsychosocial model and that everybody uses the same framework and that you're always invited to fill in that triangle and not just one side of it.
I would really like to support the idea of put forward by Jo Denekens now. I was a GP for 10 years and I looked at it as a pro-psychiatrist, or pre-psychiatrist, I should say, not a pro. I think this is an excellent idea. What I would suggest is also to introduce psychiatry.
Can you be short? Because I heard that we only have 10 minutes.
I would introduce it into every training for a person working with children. I'm talking on behalf of my wife, who has been a teacher, and she was a guiding person for all youngsters. The same for my two daughters. So every youngster, boy, girl with a problem addresses them, and then they come to me for consultations during breakfast or in the evening. And if they would have training in very general, specific issues, it has been brought forward by the youngsters this morning in the movie, I think this would already be a step forward. And the same goes for school doctors as well. And I think also for GPs, especially for those who work in group practices. Thank you.
I think we do have some practitioner like, I don't know, well, she was talking about, we have doctors who are trained in youth health care and which work mostly as school doctors are in CLB or kindergezin. And I think it's good that we have them, and perhaps there should be more of them, and they can be implied in other practices too, not only in the CLB or I don't know where. But I think it's also very important, as you say, that every professional who is working with children should be introduced in the psychosocial model of thinking. And I also think that in training programs, in basic training programs, that different students from different richtingen should solve cases together and learn from each other to see here I have no answer anymore, I don't know anymore what question to ask, and then another student will say, oh yes, but we can also ask this, and that's something that isn't realized up to today.
Yes. Mm-hmm. Okay, yeah, we are changing to the second topic, which is about this primary prevention, universal prevention. It's clear that we need to make that shift that we need to try and prevent because of the increasing number, because of the increasing risk factors, because of increasing school dropouts. So let's go immediately. We know the problem. Let's go immediately to, we try to stay away from infant mental health because that's another workshop. So we could make all sorts of advices for infant mental health. But what other different types of prevention programs do you see feasible in Belgium? Yes, please. Kunnen jullie de microfoon even?
So my English is not so good, but I'm trying. I'm working for Kind en Gezin, and we ask Nederlands. Oké.
Ja.
Dus ja, ik werk voor Kind en Gezin.
I'm gonna speak Dutch. To answer your question, how can it be integrating in postpartum depression? We integrated that in our care by asking 2 questions. After birth, to all parents, we ask this question. And we see that care providers are reluctant to ask the question and to integrate it. I think it is very important to break taboos. It is important to be able to ask different questions.
Okay.
Okay, so
perhaps
other ideas for primary intervention.
You have to work together then with other people, like a psychologist in the same team, and you have to talk about it with each other, I think. Yeah.
Ja. Hier vooraan.
So I was thinking also like youth work is really breed.
Je mag ook in het Nederlands, maakt niet uit.
Dus,
Working with youngsters is complex, but I think it is important to work with the psychosocial prism. It's important to ask them, how do you feel? That is important to ask that. Also focusing on children, on their feelings. In doing so, you create a safe climate to be able to talk about problems. If there aren't, well, that's the better. But we allow a time to talk about that. So in youth movements, we should be doing this as well. People working in the youth area should benefit from a training because most youngsters are developing and arrive at dysfunction but do not benefit from any training. I took part in a kick-off meeting from the Mental Health Youth Network, and it was very clear that they do not have the skills to be able to address it, to deal with such issues. So people active in youth movements say they are not able to address those issues. We are here to support people for their plays and to play on a Sunday morning, so training would be important for them.
Not foresee the needs of the population. So we are always putting out fires. And some countries have been doing some interesting initiatives in order to foresee the needs, and I'm thinking with pregnant women here. One example is the declaration of pregnancy that has been put in place in some countries. It can be voluntary or not, but basically people can declare that they're pregnant and can declare if they have needs like food insecurity or if they are not well mentally. And so this allows service providers to foresee the quantity of help and the type of help that will be needed in a few months. And there are also very well-known risk factors that if we know in pregnancy that so many women will have children and they have X, Y, Z risk factors, that it would be better if they had access to X, Y, Z type of service. That's, and one important part too regarding the screening aspect that one person mentioned. Of course, screening for mental health is a bit worrisome because we may find that a lot of people have a lot of problems, but it's impossible to monitor what we're doing if we don't screen, and it's impossible to improve if we do not measure the subsequently down the road the impact of our services. So that's a key element too.
In that case, you're talking already about secondary prevention because you're identifying risk groups, whereas one of the big questions was, is primary prevention, is universal prevention possible for mental health care? And universal means that you're giving it to everybody. So any ideas about that? Arthur? Sorry, wil jij ook de... Ja.
Ik heb eigenlijk geen flauw idee of wat dat...
I don't know whether you already discussed about that. Leisure is really important. But school is really important because for children, children are very spending long hours at school. And problems arise at school, and sometimes the teachers, if they have not been trained properly, cannot see that. What's your hope? Would you like to have teachers better trained? Or would you like to have a person in charge of those matters at school? Well, I think that teachers see children all day long. I think that, therefore, taking into account mental health into the training of teachers is important, and making sure that mental well-being is normal at school. At school, we vehiculate different values, we promote different values, and that's important. You just confirmed it. So 1, 2, 3, and 5. People wanting to take the floor. I just wanted to react on what you said. I fully agree with you. Schools have more expertise, but they have limited knowledge, not diagnosing ADHD, for example. It's important to open dialogues, and otherwise we'll create mini experts and people who think they know everything. It's not good.
We've been talking about training, then we're talking about universal prevention, but universal prevention doesn't mean that every person needs to know everything. They need to know what to help in first place, to be there, to listen, and then if it sounds more severe, they need to know where to go. So that map that is going to be made somewhere in another workshop is, again, a very important tool to work from. Wacht, hè. Wou jij nog iets? Nee. Daar waren nog, ja.
Arthur.
Interventions, I basically go in that sense. I also wanted to add, in reference to what was said in the film, there was a lot of comments on by the kids on how they wish they had, for instance, a class at school telling them more about mental health, so they could have more literacy. And I think increasing literacy on mental health is very important.
Yeah, and probably from a very early age onwards, so that it sounds normal.
To fight stigmatization.
Ik heb zo al een paar dingen.
Ik wilde graag nog op aansluiten op wat mevrouw daarnet zei. Denk dat inderdaad.
I just wanted to react on what has been said. I think that it is indeed important that adults can see the different signals. It must be said that all children are not sending signals. That's what I'm saying, says the other lady over there, but she should use a microphone for the interpreters. If a child is throwing a tantrum, a chair also in the corridor, you see it clearly. But if a child says nothing in the classroom, it's not so evident. Therefore, we cannot assume mistakenly that children can always go towards a contact person, a trust person. Hence, it is important to have an offer, guaranteed offer for children and parents upon request or at given moments, so that they can talk with such a person. Well, ladies and gentlemen, we do no longer have a lot of time. Youngsters will have the final word. Just very quickly, I wanted to say that when we talk about mental health with children, from my own experience, I think it is important to have the right approach. Because you must be very careful not to block the child. He's going to smile in an artificial manner because he's very polite, but it's very difficult. And the simple question, how are you doing? Is it the right approach? I don't know, because personally I always say, I'm fine, thank you very much. So also what I wanted to add on internalization, histories of youngsters living through that, going through that can be very useful. Because they know that they are not alone. It can encourage young people, children, to go and talk about that. Because young people tend to think that they might be abnormal otherwise. This could be done in classrooms. Right, thank you very much. Thank you very much for your ideas. No, please, I wanted to add something again. Keep on doing researches. Does that exist? Is this normal? Or on TV, when I was looking TV, there was a program on mental health. I was looking at it. So I was always doing researches on that. Yes, indeed, it was mentioned by psychology professors. And in fact, we would need a daily program on well-being on TV.
This is working. Yeah, this is working. Okay, thank you. We're a little bit improvising because normally the two workshops are added together, but I think we will manage. We have many more on the stage. I will introduce them shortly. And Mika, you are one of our lead workers in the participative group. Mika zegt zelf over zichzelf, ik ben een jongere die zelf een lange weg afgelegd heeft.
Yes, Mika. Mika has come a long way, and you give a lot of importance to listening young and adolescents on who have mental issues. And I know that you're very ambitious in tackling this subject.
Too extensive, but we are really, really happy and delighted to welcoming you here, because participation is one of your passion also, and we learned already a lot, and I think we have put in some steps forward, but we need your advice and, of course, your ideas implementing participation even better than when we started it now. Thank you very much for being here. Sarah is klinisch psycholoog.
So Sarah is a clinician psychologist at the University of Ghent, and you will explain how you ended up working on participation. And then we have our two last speakers working for the Ministry for Public Health, and they've been working on participation and on the participatory approach. We have drafted on paper 4 questions, and I will ask our experts to comment on these topics and to tell us more about their work. And then if we have some time left, you will have the time to voice your comments about the participatory approach. Mika, over to you to kick off. Good afternoon. My name is Mika. I've come a long way, as it has been said. At the beginning, I was a bit reluctant to speak about myself, to say how I felt, or to disagree with anything, because I didn't dare to disagree. And then I started, talking inside a group of patients. I started talking about my own experience, but very often I was told, okay, point noted, we'll see what we can do. But nothing was being done based on the information we had given. So this was not a true participatory approach. And I thought it was pointless to speak about my case and to speak about how I felt. I've seen many children and young people stopping having a say because they felt they were not listened to. And at a certain point in my life, I also wanted to stop speaking my voice, but in the end, I continued speaking about the positives and the negatives. I found the right people, the right friends, and that helped me speak my voice. And over the past 2 years, I do see some very nice progress. I see that I am being heard, I am being listened to, though it requires a lot of courage. I need to be very brave, but I start talking about the importance of being heard and being listened to other young people of my age, because I think that we have to give a practical insight about what can be done in the different institutions. Right. So we drafted a document at the request of public authorities, and perhaps Sarah will tell us more about how we initiated the drafting of the document. And unfortunately, yes, the microphone is working, sorry. So for 2 years, I worked within a pilot project of the Ministry for Public Health on the participatory approach of children and teenagers in the mental health sector. This is a pilot project that emerged after a text was drafted by another public authority on the importance of this participatory approach. And at the time, and I see many faces and many people here in the room who were interrogated at the time, and many issues were raised during the interviews. Some said that the participatory approach seems to be a very broad concept, but how do we go about? Is there any quality label? Is there a definition for this participatory approach? Now, what is important to me is that, as Yvonne said, participation is a right that any children are entitled to, whatever their age, whatever their degree of maturity, whatever they need or don't need mental health care. Any children is entitled to this participatory approach in all fields of life where mental health care comes into play. And I would see 4 items that are part of participation. First of all, we must give children and adolescents the opportunity to be heard. We need to ask them, are you being heard? Are you being listened to? Second principle, second item, how can we make sure that these children are being heard? We need to open up possibilities for them. And then third item, we need to make sure that there is an audience, that there is someone that listens to this voice. And are these people the right people, those who listen? Are there truly the right people in place? And then what is the follow-up action that can be taken? Now, it's very nice to be here together today, but what will happen afterwards? And I think that children and adolescents must also be part of this follow-up message of the next actions that will be taken. And as we know, participation is not a one-shot process. It must be a permanent process. This is what I had to say. Thank you. And I think that we have made progress, yes. And what Sarah has just mentioned is the signal that we are making progress. And I think that the health ministry is convinced that children and adolescents must be seen as active participants, and they deserve a targeted care, efficient care. And I think that reforming mental health care for children and adolescents is also key. Since 2015, there are various networks grasping the issue of mental health care. We have a pilot project, and throughout the pilot project, we've been able to identify the needs in terms of mental health care. We are continue to draw the lessons of what we have learned about participation, and we know that we need a very specific commitment. We must work with people who are able to give a targeted support. This morning, our health minister said that a participation coach had been appointed for each Belgian district. And we have here with us Erin, Louise, Annelies. There's some of the coaches, 2 Dutch-speaking and 2 French-speaking participation coaches that have been appointed to promote children participation, and together they will need to identify the type of solutions that people like Mika would need. I'm very glad to have you here, Mika. We've had the opportunity to speak together on many occasions, and well, it is a pity that well, at the time, you found no one to speak to. I think that our newly appointed coaches will be able to help people like Mika finding someone to talk to. Now, of course, they must work based on a list of criteria with young people. They need inform people about mental health disorders in a way that is clearly understood by young and adolescents. Now, these coaches will also need to encourage young people to speak their voices about the needs that they have in terms of mental health. They will also be in charge of drawing up activities when it comes to caregiving and identify the policies, the provisions that will have to be taken. And in these policies, of course, the vision of young people will need to be better included. And I think that we must also work on better understanding the importance of caregiving for people with mental health disorders. So we have appointed all the coaches, and I think that they're all eager to start working.
To start such a participative process, and you know, it takes a lot of energy, knowledge. What would be the first question you ask people? Let's say that many of them here are really eager to start to do something about it. What would you be your first question? Or what would you ask or maybe tell them?
Is that working? Yes. If people have tried already to work in a participative way with children and young people in mental health, I'd love to hear your experiences and to understand what were the factors that enabled you to do it well, what were the barriers that you had to overcome. And some of the barriers that people have had back in the UK are, you know, one is very practical, finding funding, because we need to reimburse young people if they are moving from home. If it's all online, it's different, but we don't want to stay there forever. In our post-COVID world, we want to go back to seeing people. They need at least reimbursement. And our model, and I do this now to this day, is we automatically reimburse travel and, you know, hotels or what have you. We also give vouchers for even the smallest amount of participation, a shopping voucher of some description. And then if we're working at another level where those young people start to become skilled and doing the same job that we do, we pay them a proper salary. So, and you have to fund that somehow. I understand that. So that's a practical question that we're often asked. And then there are more kind of psycho-emotional issues of, you know, the adults feeling ready to do it, trusting themselves to do it, trusting the young people. So, yeah, I'd love to know from all of you, if you've tried or you're doing something successful, you know, what makes it work, what's difficult and gives it challenges and barriers.
Zijn er mensen die echt ook werk maken van?
Are there anyone here in the audience not working on participation because they feel that there are too many obstacles in the way? Well, I am a student in educational matters, and I have written a schoolwork on how can we better listen to children and young people, and how can we help them taking part in the decision-making process. So we have developed a few guidelines that young people and children can use if they want to be listened to on a current topic or on any topic. And I think it is indeed very important to be able to listen to these young people, whatever the subject. And I think that by working at the grassroots level, we can already start from a good basis. Any other experiences that some of you would like to share. Now, unfortunately, I do not see everyone, says the lady. I work as a psychiatric within an outreach team for children in a transition phase, and usually our team meetings are organized both with children and parents, and we take all decisions together. And I think that it makes the decision-making process easier. It is, I think, a good argument if we want to show young people and children that they are being listened to and that the conversations that we have are being followed up on. Within our group, and we saw it on the video. Someone said, "I do not want my parents to know. I do not want my parents to know what happens inside the therapist study." Now, of course, professional secrecy applies as of the age of 14. Now, we work with children facing difficult challenges in their lives, and many of them do not want their parents to know. So how can we deal with these cases? But this is what participation is all about. It is about sitting around the table with the young and telling them why we want and need to involve their parents. So we could also ask the children, why don't you want your parents to be involved in the conversation? And I think that all together we can find the right solution. Very often we've been told, don't tell my parents, don't tell my teachers. But I think that in one way or another, we always sort it out. Now, of course, it doesn't always makes everyone happy, but I think that if we are to have an open conversation, we need to open up to all the stakeholders. But, you know, experiences vary from one case to the next. As to the involvement of parents, what do you do if parents do not want to get involved, if they reject this involvement? Then the child ends up feeling even more alone. Now, in such a case, you insist on involving the parents. I don't have any clear-cut reply to that. I've had bad experiences as well. Now, you're referring to yeah, well, I don't want to deal every individual case, but I think that those who try to help should also differ the type of help that they propose. This is part of the mistakes that we make. We sometimes tend to offer the same type of help, and perhaps we have to propose a tailor-made solution based on the situation that we're faced with. Now, this is the nice idea behind participation. 10 years ago, there was no such talk around participation. The strength of participation is that we also develop tailor-made solutions, less standard solutions. We need to know what the child wants, what is the type of participation that he or she wants to have, but we can also tell the child, right, I understand that you don't want your parents to be involved, but in this case, I really need to involve your parents. This is something that you must be able to say to the child. However, you have to be cautious about adverse effects of going against the child's decision. I could try to sum up what has been said. Of course, it is not easy to involve both the child and the parent.
Yvonne, do you have suggestions in that? Because it is important sometimes to see in certain levels only the child, or talk to the child or the adolescent.
I do. Of course, I'm a parent, and so I understand why good parents want to be involved and good therapists want to involve parents. But in the company I now run, I mentioned earlier, the software exists so children can tell privately and confidentially what they want a trusted adult to know. And sometimes the thing they tell is about their parent or their caregiver, foster care, as we say. Do you have? Yeah. And that's very difficult. But, you know, every time I hear of that, I realize that how necessary it is that sometimes you have to listen to what the child says. And the problem in certain situations is they don't really have the words to tell you. So if they're saying, I don't want my parents to know, it could be that they want you to persuade them, but it also could be that they're saying, there's something bad that happens at home with my parents and I can't tell you. I do not yet even have the ideas and the language formed in my head to tell you. And which is why we built the software. It's so that there's a space for children to be private and confidential and to say something when nobody else is there, and they can be helped with the words to use. And I know it's only a small number of children, but they're important. So.
Any comment or nog iemand die hier wil op reageren?
Any reactions in the audience? Well, I don't know how to phrase this, but regarding the involvement of parents, well, this is exactly what prevented me from seeking help. I experienced a trauma with the with the Center of Support for Students. They told me, Thea, we'll go together to an assistance center, and I thought that my parents wouldn't know about it, but as soon as I arrived at the support center, the lady who was there told me that she would get in contact with my parents, and this is exactly what I wanted to avoid. So my parents came, they arrived, they asked me what I was doing there, and I was not being listened to. This was a total privacy infringement. These participation coaches who will start their work in the next future, what will be your position? I know that there are many initiatives around participation, some are most successful than others. Now, what do you plan to do as you will embark on this new journey? Now, we are mapping currently the various activities and initiatives that are ongoing in the various institutions. No need to start from scratch. We just need to combine our forces and to offer the best possible options to young people. Now, what I do see is that it is important to listen. As it has been said here and this morning, we must learn again to listen to others. And someone earlier referred to this diagnosis of autism. Now, I think that if we are able to listen more to one another, many problems could be avoided. It is important for parents, for coaches. It is important to understand what we need in order to follow a participatory approach. And I think that we must, and this is part of our mission, we must promote participation. Now, I think that for our ministry, we need to test by doing. So enough words. I think that the time has come to sit together with children and adults around the same table to think about the best way to launch this approach. Now, of course, we meet very regularly with the participation coaches to avoid making mistakes. We want to do it well. We want to stretch our hand towards children and adolescents. We want to enter their world and to become familiar with their activities and initiatives. So yes, indeed, we are mapping the various youth organizations that already exist, mapping what they do, because we do not want to bring something which is not new, which is already being done. So this is what I had to add. Barbara.
Alors, moi, je suis coordinatrice d'un réseau, et donc ça fait un certain temps qu'on est censé...
So we've been working on participation for quite a while. Our participation lead is not here today, but our objective is indeed to reach out to children. And with the previous network, we had a mapping done by professionals, and our participation lead reached out to children, and they came back within the decision-making bodies reporting about the needs of children. So yes, it is indeed important to reach out to children. You talked about funding. Now, if we are to invite children, to reach out to children in schools or in other venues, it will require funding if we are to be better familiar with their life and their needs. Thank you.
Ik wou nog iets toevoegen in het werken met jongeren met ervaring.
I wanted to add one comment. In our work with young people, we need to be very careful that we not only have one single person around the table. It can be useful, it can help us understand the real situation, but when we ask, when we want to have young people participation with expertise, I'm always asking, what do you want to do yourself? You cannot create something yourself for youngsters. You need to ask youngsters to act themselves. So I'm always worried what will happen, what will get out of such a panel, because participation is an attitude as well. So I'm facing this problem. I've been facing it for 5 years. I have young people with experience. They are not paid. We see there is money, so pay them, please. So you will motivate young people, you will commit them, recruit them even, and pay them. Create positions. Organization is of key importance as well. I think that it is a very important point, the one you just raised. And you have already done it. But I think that it is important to define participation. What is participation? Often I hear that participation is used, but it is used and abused as a word. Young people are represented in some bodies, but they also say that it is a veneer of participation, a bogus participation. So I think we need to discuss that with young people. What is participation? What is involvement? A basic participation, again, but that is, again, an extra concept on top of all the others. So that's important to define it. I agree with you. I also think that participation is a rotten term because it is a very difficult term. It is all-encompassing and it encompasses nothing at the same time. I was working with a colleague somewhere, and more often than not, we wondered what could be a better term. But it's not that easy to find a better term. We think about collaboration, cooperation, and I think we need to stop because the Queen, Her Majesty the Queen, is going to arrive, so we'll have to stop. Apologies, and thank you.
Oké.
We doen verder tijdens de koffiepauze.
Dan stel ik voor dat Sarah straks privé in de koffiepauze...
But we'll keep on working during the coffee break.